greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis, a disease caused by fungus, yeast, or mold. Mild fungal infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Sapna Wadhwani, live from Khar West, and to enlighten us on the topic of fungal infection. Dr. Sapna Wadhwani is MBBS, MD, DNB, MNAMS, FDS, Singapore fam, who completed her training from London and Singapore. She has experience of 10 years in the field and currently practicing at Khar West. Today, Dr. Sapna Wadhwani will share with us on fungal infection. First of all, welcome, Doctor, to today's platform. Our first question for you, Doctor, today would be, what is fungal infection?
Good morning. So fungal infection is basically, it affects the skin, hair and nails. So generally in the summer season, we get patients with a lot of skin fungal infections who come to the OPD with a lot of itching and a red colored rash all over the body. So it is a contagious disease, and if one member of the family has the infection, he might tend to pass on the infection to other members of the family. And especially parents, if they have infection, they can pass on to their children. So we always tell our patients that if any one of you have the infection, kindly do consult a dermatologist so that we can treat the infection and stop it then and there, instead of spreading it to the entire family. And we are not only spreading it to the family, when we are traveling and if we have touched the lesion and then we are touching the other surfaces, we are also spreading the infection in the community. So basically, if anyone has the infection, should definitely go to the nearest dermatologist and get themselves treated.
Right. Doctor, we are talking about taking care of fungal infection. So apart from that, what are the other ways we can take care of it? Like not spreading it is definitely one of the major thing we need to take care of. But to stop the spread in one's body, what do we do? What is the basic thing to do?
So basically, there are some do's and don'ts that we need to follow with fungal infection. So if we have a fungal infection, we don't need to wash our clothes separately. We need to wash our hands. Even when we are taking treatment, we apply the creams. We need to wash our hands regularly. And if any member of our family has the infection, we need to wash their clothes separately in warm water. We need to avoid eating sweet food, because what happens is when we eat sweets or even bakery products with high glycemic index, what happens is we tend to increase our sugar levels, and the fungus proliferates when our blood sugar levels are raised. And in case, athlete's foot is a common fungal infection. So in case we have that, we need to wash our socks regularly. We can't wear the same socks every time. Many people, they come to the OPD, they say we reuse our socks. So you actually need to wash your socks every day.
Right, right. Also, doctor, what are the treatments available currently for fungal infection?
So now there are a lot of treatment available. We have oral antifungals, which we start the patients on oral antifungals. We have topical creams, we have gels, we have shampoos, we have lotions. So there are many things that we have for treatment of fungal infection, depending on the area that is affected.
Right. Also, doctor, please tell our viewers what antibiotics treat fungal infections.
So basically, we need to give antifungal to treat fungal infections. Like itraconazole is one of the commonest, the first line medication which we advise, we give our patients. And generally, we give the patient treatment for varying from 2 to 4 weeks. And sometimes people are not even aware. They keep on taking this itraconazole, which would be harmful. So it needs to be under doctor supervision.
Right. Also, doctor, we have you have mentioned about like the releasing of sweat. Those are the main areas, the major areas where we tend to, have fungal infection. Uh, so during summers, we mostly see people suffering from such issues, or winters maybe. Doctor, what about female who are very much suffering from fungal infection nowadays? I see every then and there ladies mostly who tend to walk outside, who tend to use the public toilets. How can they, save themselves from having? Also, I've heard that once you tend to have it, you have a tendency of having it again and again. Is
Okay.
it true? How do like women work on that?
So for women, I would advise, like when we are using public washrooms or even at workplace, if
Mm,
there is a way you can wash the area and then use it, or nowadays there are disposable toilet covers which are available. So you can carry them in your bag and maybe use them and then discard them then and there. And in case if none of those are available, the tissue paper rolls, you can just put it on the seat and use the seat, because we don't know the person who has used the washroom before us. If that person has a fungal infection and we tend to use it, so we might contract the infection. So it is, or we can use a sanitizer, just spray the sanitizer or something like that, so that
right,
we avoid the spread of infection and even we do not contract the infection.
right. Doctor, we are talking about the external, hamperage, or the way external source hamper our body, or the way external source can, spread fungal infection. What about the internal one? Are there any over the counter medications which can also lead to fungal infection?
Over the counter medications, yes. So what happens is, over the counter people go and buy steroids. So what
Right.
happens is, there is a triple combination available which is very commonly available in our with our chemists. So all the patients tend to use that. So what happens is, when we topically apply a steroid, it pushes the
Mm,
fungal infection deeper inside the skin. So when such patients come to the OPD, it is like very difficult for us to treat the patient. Normally, if a patient would be treated in 1.5 to 2 months' time, the patient who has used a steroid, it would take double the time to treat such a patient.
mm,
So I
mm,
would
mm.
advise all the viewers not to use topical steroids for fungal infection, because what is happening is you're pushing the infection inside, which is going deeper, and you get temporary relief. Only the inflammation settles with it, but then you have a rebound infection
Mm,
post
mm.
usage of the steroid.
Right, right. Uh, with time, I mean, we are talking about this, I can't believe, but it is there in the society. With time, it has increased drastically for all the women doctor who are taking contraceptive pills on a daily basis. I have seen so many girls suffering. Does that also lead to fungal infection anyhow? Is there
Yes.
any correlation between it?
Yeah. So with oral contraceptives also, our immunity is on the lower side. So then we
Right.
tend to contract more fungal infection. So yeah, so for those patients, at least I would advise to eat more healthy food and keep
Mm.
your immune system more stronger, so that we do not contract the infection.
Right. So we are saying that any way other, it is related to the human immunity system. So if we keep our body healthy, it can fight with any of the virus or germs or bacteria or fungus which is coming in to us. Is it right, doctor?
Yes, yes.
Uh,
So
also, doctor, sorry to cut you at that. Is drinking water anyhow related to, curing fungal infection?
see, if you're more hydrated, basically drinking water in summer would help your body keep your immune system stronger. You are in a better this, but yeah, you should drink a lot of water, and so that your sweat is also not having too much of fungus.
Right,
Because
right.
what we have is, we have a natural fungus, natural flora which is there. in our skin, which is naturally present. So what happens is when we contract the infection, our natural protective infection from outside, our immunity goes down. So the infection from outside would uh, attack the skin and would cause the infection.
Right. Uh, Doctor, also there are a lot of people who take it very lightly. Having a fungal infection, they are very casual about it until and unless they see a widespread of it. Normally, patients are very much casual. They do not want to visit any expert. They do not want to visit any dermatologist. They are least bothered about it. So, what can be the worst case scenario? What is the worst, the most serious fungal infection you have seen in your experience so far?
So basically, I've seen patients coming with extensive fungal infection in, as in it's involved the entire skin from the face till the foot till the toes. So the whole body is involved. Patient is scratching in a very bad condition. And then this patient didn't want to get himself or herself treated since a long time. So it has spread, and the patient unfortunately has used over the counter steroids. So temporary there is relief, and then it's spread. The infection has spread over all his or her body. So
Right,
basically, I would advise the patients to, if you have a small rash anywhere on your body, kindly go to a dermatologist near you and get yourself treated.
right. Doctor, well, can somebody stop taking antifungal treatment if the symptom gets better earlier? Is it possible?
See, I would advise we stop oral antifungals after some times, but I would advise the patient to continue on topical medications even 2 weeks after stoppage of the treatment. Because we say even after stoppage of the resolution of the lesions, we tell the patient to continue the treatment because there might be some fungus proliferating inside in the layers of the skin.
Mm-hmm. So quite similar to the question which we have just asked you. Uh, why does fungal infection occur again and again? This is a big question which everyone might be thinking right now. Why does it happen?
Uh, it is a contagious infection, first thing, so it keeps spreading. That's why I said even if one family member, sometimes it goes like only one family member comes to us, gets themselves treated. Again, after some time, the same person comes back, Madam, I have got the infection again. And then the question arises, other family members also have the infection, and most of them say yes. So it is
Hmm.
necessary to treat all the family members who are having the infection because we are treating one of them, and then he's contracting the infection from the other family member in his house.
Right. Can it be genetically transferred as well?
No, there's no genetic role as such in fungal infection. It is more of an infection which is contagious. Our immune
Right.
system goes down, and so
Mhm.
we contract it.
Right. So I believe maintaining a proper hygiene is also very important, doctor. What do you say about that?
Yes. So that's what I said is we need to maintain a good hygiene. We need to have a bath regularly. We need to wash our clothes regularly. Um, and if anyone has the infection, we need to wash our clothes separately. So
Hmm.
that is very, very important.
Not sharing your clothes also, doctor. I
Yeah.
think it would.
Yeah.
Yes.
Not sharing your clothes, your combs. So if
Mm-hmm.
someone has a fungal infection of the scalp, might share his comb, his or her comb, and then they might tend to spread the infection.
Towel. I think towel is the uh
That is the commonest thing. Yeah, that is the
yes,
commonest thing. Sharing of the
yes,
towels. I have patients coming in. They say, we had some guests coming in and then they had some infection. They have used the towel and the
yes,
entire family has got the fungal infection. So, sharing
yes.
of the towels, napkins, all that should be avoided. Sharing of combs, all that should be avoided. Yeah.
Doctor, what about pregnant women? Can they take oral antifungal drugs while they are into the pregnancy phase?
Yes, they can take. but they need to consult a dermatologist. There are safe medications for pregnancy, antifungals, which are safe in pregnancy and lactation, can be given to patients. Why I advise most of the pregnant and lactating females to get treated, because there are chances they might spread the infection to their child. If they are
Mm-hmm.
having infection, fungal infection during pregnancy, at birth, they might spread the infection to the newborn baby. So it is
Right.
advisable for a pregnant woman to get treated during pregnancy for the fungal infection. Because if she's having the baby during the process of birth, she might spread the infection to the child, or even after birth, because she's having the child, nurturing the child, she might spread the infection to the baby. And
Right.
we do not
Right.
want the newborn baby to contract the infection at such a small age.
Right. Doctor, because we are talking about antifungals, so is it safe to take antifungals for a long time?
Antifungals is safe to take for around 2 to 4 weeks. The oral antifungals, which is safe
Right.
under doctor supervision.
Right. Right. Uh, Again, coming back to the same topic and the most basic topic, doctor, how do we identify a fungal infection? What does the first stage look like? Like people, they mostly tend to ignore it because they are not able to identify it. So what is the first stage like?
So first stage, it comes like a red colored rash. So it is
Mhm.
in a form of a ring,
Right,
which in common language what we call is a ringworm. It comes like a
right.
ring, and there's a central clear area, and there are small boils around it on the
Mm-hmm.
outer border of the ring,
Mm-hmm.
and the lesion is very itchy. So initially it is a very small thing, and it gradually increases in size over a
Right,
period of times. In some cases, it might be a little scaly, as in it might be little whitish appearance somewhere.
right.
So this is the common presentation of a skin infection, skin fungal infection. Hair would be a similar thing, but kids tend to get it with small boils and a circular lesion on the scalp, and could be associated with hair loss in that area.
Okay.
And you even have nail fungal infection, where there is redness and swelling around the nail, or that is around the nail, that is called onychomycosis, or there is infection of the nail, where you can see whitish to yellowish patch on the nail.
Mm-hmm.
So that is also very common. Females come with those who wear saris have a itchy lesion around the waist. So that
Waste,
is
right.
also common. Yeah. And there is another type of fungal infection. This is, I was talking about the ringworm thing on the skin. There is another fungal infection with very small white patches or dark patches on the front or back of the chest.
Mm-hmm.
This is also a type of fungal infection, but this is not itchy.
Okay.
So generally, patients come with these white and dark patches on the front of the chest, back, shoulder, and arm region. And these are not itchy, but this is also a type of fungus. This occurs because of sweating.
Okay. So, is that curable and does it spread like fungal infection?
That is curable. Yeah, it takes 6 to 8 weeks for it to be treated.
Mm-hmm.
Uh, it spreads. It generally doesn't spread to the other members of the family, but yeah, it is contagious.
Okay. Uh, because we talked about ringworm again, doctor, how can somebody prevent themselves from having a ringworm in their feet frequently? The one who has it, and why does it happen normally? Is it because they are walking bare feet, or on mud or muddy areas? Does it happen because of that?
So yeah, feet area, yeah, generally they are walking bare feet. Because of that, they contract the infection on their feet. And many people, when they are going to public areas like gyms, swimming pools, spas, saunas, there also, if you're walking bare feet, someone has had the infection, you might tend to contract the infection. So that is also the reason it could occur.
Right, right. And how can they prevent themselves? Maybe wearing shoes can be one of the way, or what do you suggest, doctor?
Yeah, wearing shoes or any form of footwear, they need to wear shoes, or if they're going to some temple or some religious place where they can't wear their shoes, I would advise wearing a socks at least.
Mhm. Okay. Well, I can see a lot of viewers asking questions. I believe most of the people are suffering with fungal infection and they can relate to the topic which we are talking on today. The first question, doctor, comes from Ginni Sharma, who asks, can fungal infections be transmitted between humans and animals? And if so, what precautions should pet owners take?
So if your pet is having an infection, you need to definitely go and show the vet so that
Mm-hmm.
the pet is treated first, because the owners are definitely cuddling the pet and handling it. So you definitely need to treat the pet.
Right, right. So we are saying that it can be transmitted from animals as well.
Fungal infection, I personally haven't seen it is being transferred from animals. But yeah, if you could say a mite infection from an animal, which is very commonly transmitted from an animal to human beings, yes, I have seen a lot of patients who's having pets, cats and dogs, having mite infection, and the owners are getting the infection.
Well, I believe, Guinea, I got your answer. The next question comes from Pooja Sharma, who asks, what are the potential long-term consequences of untreated or reoccurrent fungal infections, particularly in case of chronic skin or nail infections?
So recurrence is very common, because what is happening is patients are not compliant to the treatments. They take treatment for maybe 10 to 15 days. They feel they feel better, and then they stop the treatment, and then there is again recurrence. So what happens is, once the recurrence develops, uh, the fungus also tends to become resistant to the infection. So as doctors, we tell the patient, you complete the treatment, because once you there is recurrence, the fungus is developing resistance to treatment, then I have to go on the second line of treatment.
Right, right. Well, the next question, doctor, comes from Pooja Vishwakarma, who asks, I have heard about fungal infections mimicking other conditions like Alzheimer or psoriasis. How can these infections be accurately diagnosed, especially when they present with a typical symptom?
So there is a entity called as psoriasiform fungal infection, which mimics psoriasis. They are more scaly. So to differentiate, you definitely need to go and show a dermatologist who is an expert in differentiating both the conditions. So yes, definitely you need to show a dermatologist who will help you in differentiating and then treating the condition.
Right.
Because
So,
it is
doctor,
very
a
difficult
question.
for a layman to treat, sorry for interrupting, difficult for a layman to treat the condition on his own, because differentiating becomes difficult. They look very similar.
Right, right. Again, because you have said this thing, a similar kind of question has come to my mind, a little out of the context. For the women who are suffering from vaginal infection or fungal infection, the area normally is moist and they tend to have, infection very easily. So, for them, who do they go for the solution? A dermatologist or a gynac?
If they have a vaginal fungal infection, they have to go to a dermatologist. And the thing is, if they only go to what we dermatologists do is, we need to treat both the partners. If a female is having a vaginal fungal infection, we need to treat both the partners.
Right.
Generally, I tend to call the spouse also of the patient, and I tend to treat both of them, because it is a ping pong infection. Like, one patient has it, and then the partner will get it. And most of the
Right.
times the partners are asymptomatic. Only the female is complaining of itching and the lesions. The husband does not have the lesions, but still you need to treat the partner.
Okay, I think this is one of the I think most important thing which doctor has mentioned today. I haven't heard anybody saying it before, but again, it's one of the most basic thing. For the women who are suffering, they do not feel like sharing. Also, of course, Indian society, we have women who don't say it all, who always has it hidden, at least some part they have it hidden inside them. So it's for you. Please, please, please go and get it treated before it gets worst. The next question comes, doctor, from Yash Namdev, who asks, what is Candida albi albicans, and
Albicans.
what are these common infections caused by?
So Candida albicans is a species. It causes candidiasis. Candidiasis, it is generally in the oral cavity, what we call as oral thrush, or in the vaginal, that is vaginal candidiasis, or even males get it. So that with a dermatologist with oral antifungals and topical antifungals.
Right, right.
And sometimes even lactating mothers get thrush on the breast and the nipples because of lactation. So that in those cases also, they also need to be treated. Many of us Indian women are not aware of this. So they, when they are lactating, they don't know, they are complaining of pain in the breast and they are not even sharing it. So generally this occurs because of the candidiasis in the baby's mouth. So that because of that, the mother gets the infection or vice versa. So in those cases, the baby as well as the mother both need to be treated.
Right. Doctor, what about children? How do we take care of them? Because we cannot stop them from going outside or playing with their fellow mates. What if they get it from outside, and how do we protect themselves from having fungal infections, especially during this time?
So for children, I advise all the parents, they need to play. So when they come back, they need to wash their hands, or if possible, give them a bath. So that, and give them very healthy food. So they need to eat all sorts of vegetables and fruits that are available in the market, so that their immune system is strong. And we also have to maintain hygiene, and we need to wash their clothes regularly when they come back from playing. Wash their clothes, their socks, and their shoes also.
Right. Doctor, the next question comes from Gaurav Garg, who asks, how do fungal infections differ from bacterial infections?
So bacterial infection is basically caused by bacteria. So we need to treat with antibiotics.
Mhm.
Fungal infection is caused by fungus, which needs to be treated with antifungal.
Well, that simple it was. Uh, we are on talk with Dr. Sapna today, and of course, a very, very important topic which we are. I mean, almost everybody, I think, has faced this problem before. Um, Doctor, it was a very, very interesting session with you today. Um, Again, before we leave, Doctor, any take-home note for our viewers who are watching us right now?
Take home messages, kindly please get your infection treated, because just leaving it, we are spreading the infection to the community. And we do not want it to spread. We want to stop the infection, and we don't want our little children to be infected with these infections. So kindly keep your immune system boosted, and if you could maintain a good hygiene is also one more thing. And unfortunately, we do not have anything. We need to wash our shoes, because we don't have, like abroad people have machines where they sanitize their shoes. And those machines, they actually kill the fungus from shoes. But we unfortunately do not have this in India. So we need to wash our clothes, shoes, socks, and then we need to dry them properly in the sun.
Right, right. Doctor, before we leave again, because you have mentioned India, we Indian people, we always have a mentality कि हमें तो कुछ नहीं हो सकता है. We always feel that we feel that we are the most strongest of all. हमें कुछ भी नहीं हो सकता है, कुछ भी होगा हम तो खुद अपने से ठीक हो जाएंगे. और कुछ भी हो, घरेलू नुस्खे तो है ही हमारे पास. So any घरेलू नुस्खे for fungal infections? Is there any घरेलू नुस्खे?
They say Garelu Naske is there. You can use tea tree oil or you can use honey, but I don't know how far that works. They say
Right,
Garelu Nukse are there. Even for scalp fungal infection, they say राई का तेल, that is mustard oil लगाओ. But mustard oil, though I have read in literature, mustard oil has some antifungal benefits. So you can though try with your antifungal treatments.
Right, right, right. Well, we always say that कि please अपनी जांच खुद ना करें, आपका जांच करने के लिए experts मौजूद है. So please visit your nearest expert and get your problems treated as soon as possible. They are the best person. They are a dedicated person to treat it. Please, please, अपनी जांच खुद ना करें. Again, we would like to thank you so much, Doctor, for joining us today. That was Dr. Sapna Wadhwani for us. Thank you so much, Doctor, for your valuable time. It
Thank
has
you.
been quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and update on skin health and care, stay updated and connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day. Stay safe and stay healthy.